Good morning, everyone. Welcome to week 2. I know we're about halfway through the week, and I appreciate your patience with me getting this video up as I got back from Haydn on late Monday. So, welcome. This week, as you know, our topic is health promotion and prenatal care, and we're going to be building on the content that we studied in Module 1 and starting our discussion about topics relating to what we actually do for women during pregnancy. Some of the topics that we are learning about this week are the content and schedule of prenatal visits, establishing gravida and parity status, assessing fundal height, addressing health issues that come up during prenatal visits, things like over-the-counter medication, immunizations, travel, alcohol, tobacco use, dental care, and also giving anticipatory guidance to women. So as far as general information this week, be sure you've watched the course orientation and that you've posted any questions you have about the course organization or where to find things in the course forum. You can always go back and re-listen to that orientation, or you can just post any questions you have in the course forum as well. Also, be sure that you have found our first open office lecture session in the big blue button area in the course. Remember, we had some technical difficulties with that first session, so you can fast forward through about the first 20 to 30 minutes, I think, of that session where we were just figuring out technical issues. And then the content is at the last half of the course. So I've said it before, but please remember the following things. It's easier if you use Chrome to access Big Blue Button. Use your headset and make sure it's plugged into your computer before you access Big Blue Button. Sometimes I think that makes it easier for your computer to recognize that it's supposed to listen to you on your headset. If you don't have a headset, you can certainly try to attend with your built-in mic on your computer. That's routinely what I use, and I find that it works really well if I'm in a very quiet environment. So if you don't have a headset and you want to participate, if your computer has a built-in mic, usually you can still participate, especially in these kind of informal open office sessions. For a lecture or something that you were giving, I would recommend you use a headset. So when you log into Big Blue Button, please log in the talk mode, not listen only mode. And then you can mute once you're in Big Blue Button. And if there's a situation where, for example, if I was giving a presentation, like in one of your other classes, you may have where the faculty actually lecture during the Big Blue Button session, we can mute everyone so that we don't get feedback and that sort of thing when we're the presenter. And so if you log in talk mode, you will be able to ask questions when it's question time. And for our open office lecture sessions, you'll be able to participate by talking. If you log in listen only mode, it doesn't quite work that way. So we won't be able to hear you in that case. You still can you can still chat and type. And you can also call in using the phone number. So if you're having a hard time with your audio, you can call in and you're on your phone line. And when you first log in, there's a bunch of blue text that shows up in your chat window, and the phone number is there. So you can call in on that phone line and be able to talk and participate that way as well. So please let me know if you run into any link problems when you're looking through the lectures. Links change all the time, and so you may run, as you're studying, you may run into a link that doesn't work. If that's the case, just post it in the forum and we'll be sure and respond and fix that. It's hard, kind of, even though we double check, it's hard to stay on top of them because they change so often sometimes. I just posted a link in the Module 1 discussion forum about sensitivity, specificity, positive predictive value, and negative predictive value. It's actually a PowerPoint with audio on every slide, so you can go through it and listen to each slide as many times as you need to kind of understand that concept. And I know there's been a little bit of discussion in a post that I posted earlier and some questions about it. So I just encourage you to listen to this presentation and hopefully it'll clear everything up. For this module, for Module 1 about risk assessment, what's important is that you understand these terms and what they mean. You will never have to do any math calculations surrounding them. So you'll see in the presentation that we talk about how you get the result. And that's just important for you to understand the concept, not important for you to understand how to actually do the math. So you need to understand these so that you can explain them to women in more detail when you're talking about screening tests. So if you have an understanding of how these concepts work, then you'll be able to explain that better to women when you're discussing these concepts about risk and screening with them. So we're going to discuss genetic screening in a lot more detail come Module 8, so you don't need to know the details about, I used Down syndrome and quad screen as an example in the presentation, but it's just an example. So when you get to Module 8, you'll probably want to go back and look at that again. And my phone's going off, isn't that lovely? Playing Jingle Bells still, nice. So when we get to Module 8, we will look more at those concepts, and we'll see how that works. So for forum discussions, some of you have participated in the Module 1 forum discussions. Thank you so much for your thoughtful responses. You'll notice that there's some case studies posted for Module 2, and this is a great place for you to go as you study the content to read and participate in those discussions to critically apply the things that you're learning. It'll really help you in your understanding of the material. So I encourage you all to participate in the forums, or at the very least, be sure to read the forums. They'll really help you with your understanding. People who tend to be active in the forums do better in the course overall. You get a chance to critically think about and apply the content that you're reading and learning about. A lot of teaching goes on in the forums, and that's where we like to interact about the course content with you as you learn it. Also, you'll notice that we may not answer directly questions that you have in the forums. That's because we want you to find the answers, because when you find the answers to your own questions and we help guide you to the place to find those answers, you tend to have long-term retention of the material. Whereas when we just give you an answer, it's in and out of your head and you don't always remember that. So we'll encourage you to look for the answers that you need. So please don't be frustrated if that's what happens in the forums, because it's our job to guide you to learn what you need to know. So that's where, like I said, a lot of the teaching goes on in those forums, because we help you to find the answers to your questions and to think about different ways that you can address the topics at hand. So we tend in the forums to focus on case studies because it's really a great medium for you to critically think about that course content. Now, one of the important things for you to remember when you begin your clinical courses is that you'll need to begin to individualize the knowledge and information that you have to a specific client situation. Now, it's important to know the content just by itself, but you also need to critically consider how it applies to each individual woman that you might come into contact with. And this requires you to reflect upon the content of your knowledge as a whole and then apply it to a particular situation with one particular woman. And this is a skill that you'll develop as you gain more experience. Remember, we want to make the women experts about their own pregnancies. So we want to know how to tell them and how to explain our rationale for what we advise them about over-the-counter medications or those types of topics. It's not enough to just tell someone what you recommend. You need to tell them why you recommend it and get informed consent, which we'll talk about later on. If we believe in educating women and partnering with them, then it's our job to make them the experts on their own pregnancy. So that includes offering them complete information and the ability to make decisions that are right for them. So your Module 1 and 2 learning assessment activities are due by the Exam 1 submission deadline if you choose to complete those. Although it's a couple weeks in the future, we recommend that you work on those learning assessment activities at the same time you're working on the modules, because it helps cement your learning about that particular content. Remember, you need to do 5 learning assessment activities, no more than 1 per module for 5 modules. And you can choose from the options available in the modules as you pick the learning assessment activities to pick the one that seems right for you. So at this point, you should have started and completed your Module 1 readings and be into your Module 2 readings. And some of you may find it interesting to read Chapter 14 in Jordan. It deals with social issues in pregnancy like poverty, incarcerated women, intimate partner violence, and sexual abuse. It won't be covered on the exam, but it does dovetail nicely with the information that's there in this module. So I suggest that you begin your work on the modules by reading the lecture and inserting the readings as you work through the lectures. Also, I suggest you print out the learning guide questions and use those as you guide your study as you do your readings. So our next exam is Exam 1. It will be available during week 3. It opens on Monday at 8 a.m. and closes the following Sunday around midnight. And please review the exam information and tech tips and the remote proctor requirements and all that information before you take the exam. I've also posted the exam blueprint and some study helpful information and study topics in the exam blueprint and study helps folder in the exam folder under the course content area of the course. So if you click course content, exams folder, you'll see exam blueprint and study helps folder. And in there, you'll find information for Exam 1 that will be helpful when you're ready to start studying for that exam. So, as you know, last week's open office lecture session was a bit of a challenge. Hopefully this week will go smoother with Big Blue Button, and we'll find out today at 3 p.m. Eastern, because that's when our next open office lecture session is. So remember, no new content is presented in the open office sessions, but we just talk about the content that's already been presented in the course, and you all get to choose what content you want to talk about because we'll talk about whatever questions you bring with you. So it doesn't necessarily have to be about the module for the week that we're on, but it should be about, modules that are close to where we're at in the course. So they're scheduled so that those of you who have questions about concepts can come and we can talk about it. But if you can't attend, you can always post your questions in the course forum, and those recordings of those lecture sessions are available for you, and they're found in the big blue button tab in the course. So today, 3 o'clock Eastern, is our next open office lecture, and I hope to see some of you there. So please feel free to post any questions you have in the course forum. I look forward to talking to you there and hope to see you at our session today. Thanks so much and have a great week. Bye.